A time comes in the life of every race when people are driven by echoes of the past to chart a course for an exalted future. Africa is at this threshold, as major actors in the Africa arena plots a renaissance towards common destiny. Let's pedal across the streams of yesterday, from the backstreets of Africa to the defining roles of policymakers, the political realities of the African nation, balance of power, and the strive to sustain national interest and identity. Join us on Network Africa on Channels Television. Network Africa, the rallying point for the emergence of a new Africa.
On Network Africa this week, it's all about health, and illegal migration. The threat of Ebola continues not only here in Nigeria, but also in other African countries. The situation gets so intense that Liberia suspends football in a bid to limit the spread of the virus. Meanwhile, the world's newest country, South Sudan, faces the worst case of famine in the world.
Man was rough, especially when they're going to town to buy their goods for their business.
And 180 African migrants die while making a treacherous journey by boat from Libya to Sicily, with many bodies believed to have been thrown overboard.
Many of the migrants, they were stabbed, they were kicked. Some of them were thrown at sea during these kind of battles of survivals.
Hello and welcome to the first episode of Network Africa for the month of August. I am Amarachi Ubani. This week we'll start things off right here in Nigeria. Right now, the word that seems to be on everyone's lips is Ebola. Symptoms of this deadly virus typically start 2 days to 3 weeks after contracting the virus, with a fever, throat and muscle pains, and of course headaches. A reason why it's caused such a stir is due to the death of Patrick Sawyer, who arrived in Nigeria from Liberia and was carrying the virus. He was treated in First Consultants Medical Center, and in a bid to contain the spread of the virus, the hospital was also closed.
Nigerian health authorities are in the process of tracing more than 30,000 people who could be at risk of contracting Ebola after the virus surfaced in Lagos. The authorities have confirmed that a Liberian man who died in Lagos last Friday tested positive for Ebola. After the discovery, the hospital that dealt with Nigeria's first known Ebola victim was closed. Professor Sunday Omilabu from Lagos University Teaching Hospital said the health authorities are now tracing everyone who may have had contact with the victim.
We've been making contacts. We now have information about the manifest. We have information about who and who were around. So as I'm talking, our teams are in the facility, so where they've trained the staff, and then they're now asking questions about those that were closely in contact with the patient.
We're actually looking at contacting over 30,000 people in this very scenario, because any and everybody that has contacted this person is going to be treated as a suspect. 2
teams of experts in epidemics are being dispatched after Patrick Sawyer died. The consultants for the Liberian Finance Ministry collapsed on arrival in Nigeria.
We understand that in this part of the world, the borders are very, very porous, so it's quite easy for people to cross from one country into another without detection, without using regular border crossings. So we see the most effective response to outbreaks such as this is to undertake clinical testing, laboratory testing, clinical management. Contact tracing is essential.
Authorities are also monitoring 59 people who were in contact with him.
Both the states and the federal governments are up in arms to ensure that the virus does not escape and that no Nigerian is infected with this virus.
It is the first recorded case of Ebola in Nigeria, and the government is concerned as the disease is highly contagious, with symptoms including vomiting, internal and external bleeding. It can kill up to 90% of people who catch it. Meanwhile, the federal government has put all ports of entry on red alert and is running a media campaign to alert the public. Officials say that their health services are equipped to deal with any outbreak and that staff are properly trained.
Nigeria is not the only country taking steps to control the spread of this deadly virus. Liberia is doing the same. The country has suspended all football activities due to the fact that there is a risk of infection because football is a contact sport. Now, according to new UN figures, the number of people killed by the virus in West Africa alone has now reached 672. A major regional airliner in the country has also halted flights to the Liberian and Sierra-Leone capitals because of growing concerns about the virus.
U.S. Centers for Disease Control and Prevention, CDC, the State Departments and colleagues of an American doctor are speaking out after 33-year-old Dr. Kent Brantley, who was working for a relief organization in Liberia's capital, tested positive for the